was so ashamed. But I
The demands and dynamism in the health sector has attracted Cipla Uganda, a pharmaceutical company, to diversify its production without limiting to only three main health issues of HIV, hepatitis B and malaria.
A greater need to have a quality product in private sector and our entry into private sector, along with a greater focus on local manufacturing of products. We will introduce new products in next 5 years in the new therapy areas like anti-infectives, pain, CB diabetics, gastro, and anti-cancer and sickle cell.
In the company's 2022 annual general meeting, it was established that all legal requirements have been met to establish a special facility to commence the production of 9 new products to handle different health solutions.
We have obtained all necessary approvals from the local regulators and authorities and completed the detailed engineering. And we are in the last phase of finalizing the negotiation and allotment of contract to begin construction of this facility.
The pharmaceutical company has registered local sales increment in the ending year 2021-2022 of 3% and the local sales increment by 19%.
Revenue grew from 261 billion to 267 billion, representing a growth of 3%. When you compare our revenue and where we started from at the time of listing, our compounded annual growth in revenue has been 7%.
A 2 Ugandan shillings dividend per share has been announced, which is based on the gross profit margin increment of 27%.
The board, upon consideration of the dividend policy, determined that the most appropriate distributable amount was 30% of the earnings per share, and 30% of earnings per share of 6.59 was 1.9, which was rounded up at 2 shillings per share for the dividend.
The company's profit after tax has increased to 24 billion Ugandan shillings in this year under review from the loss of 11 billion shillings over 2020-2021. This is the first time Cipla Uganda Limited to give dividends to its shareholders since it was listed on the country's stock market. Abdul Nasser Lubwama, UBC News.
But I needed to tell someone.